The One Big Beautiful Bill, signed into law July 4th, 2025, is one of the most sweeping pieces of healthcare legislation in recent decades. It reshapes major programs like Medicaid and Medicare, tightens rules for Affordable Care Act subsidies, and expands the use of health savings accounts while making permanent certain telehealth benefits. Proponents hail it as a necessary reform to cut waste, restore accountability, and give individuals more control over their healthcare choices. Critics see it as a massive rollback of a safety net that will cause millions to lose coverage, place financial strain on hospitals, and deepen inequities in access to care. Today, we're breaking down what's in the bill in regards to healthcare and looking at each area in detail and weighing in on both sides of the debate. One of the biggest changes comes to Medicaid. The bill adds work and community engagement requirements for most non-disabled adults between the ages of 19 and 64, mandating at least 80 hours per month of employment, education, or volunteer service to maintain coverage. There are exemptions for certain groups, such as parents of young children, veterans, the medically frail, but the core requirements will affect millions. Expansion enrollees will now face cost sharing of up to $35 per service, although primary care, mental health, and visits to federally qualified health centers remain exempt. Retroactive coverage is shortened from 3 months to 1 month for expansion enrollees and 2 months for traditional recipients. This means that new enrollees could be left with unpaid medical bills if they seek care before their paperwork is processed. States will now be required to re-verify eligibility every 6 months instead of annually, and a freeze and phase down of provider taxes from 6% to 3.5% in expansion states. This will reduce a major funding stream for hospitals and nursing homes. But to help offset some of the rural impact, the bill sets aside $50 billion over 5 years in a rural health transformation program aimed at helping struggling hospitals modernize and recruit staff. Supporters of these Medicaid changes argue that work requirements promote independence and reduce fraud, that cost sharing discourages unnecessary use of services, and that more frequent eligibility checks ensure benefits go to only those who truly qualify. They point to the rural health investment as proof that lawmakers are not abandoning vulnerable areas, but are instead targeting aid to where it's needed the most. Opponents counter that administrative barriers will inevitably lead to coverage losses. Estimates range from 10 to 12 million people, and that cost sharing will deter low-income patients from seeking even essential care. They warn that cuts to provider taxes could trigger a wave of closures of hospitals and nursing homes, particularly in rural communities, despite the targeted aid, and that past experiments with work requirements in other states have shown little increase in employment, but significant drops in coverage. Moving on, Medicare also sees significant changes under the bill. 2 finalized rules that would have made it easier for low-income seniors to qualify for Medicare savings programs, helping them pay premiums and out-of-pocket costs, are delayed until October 2034. Immigration-based eligibility restrictions mean that even some individuals who have paid into the program will no longer qualify. And provisions that would have allowed Medicare to negotiate prices on certain high-cost drugs are scaled back, with delays and exemptions that the Congressional Budget Office says will reduce projected savings by billions over the next decade. Proponents say these measures protect taxpayer dollars and preserve incentives for pharmaceutical innovation. Critics argue they will leave the most vulnerable seniors paying more out of pocket for longer, and that delaying drug price negotiations is a gift to the pharmaceutical industry at the expense of patients. The Affordable Care Act marketplaces are also reshaped. The bill tightens eligibility for premium tax credits, ending automatic re-enrollment for many plans, adding stricter income verification, and excluding most categories of lawfully present immigrants from subsidy and eligibility unless they are citizens or fall into narrow exceptions. Advocates for these provisions say they close loopholes, prevent improper payments, and ensure subsidies are targeted to citizens and permanent residents. Opponents warn that ending automatic re-enrollment will lead to coverage gaps, as some people may miss deadlines or fail to reapply, and that excluding immigrants will increase the number of uninsured, shifting more uncompensated care costs to hospitals and states. One area the bill expands options is health savings accounts and telehealth. It permanently allows high deductible health plans to cover telehealth services before the deductible without jeopardizing HSA eligibility. A change made retroactively in January 1st, 2025. Starting in 2026, HSA funds can be used to pay for direct primary care membership fees, and certain bronze and catastrophic marketplace plans will qualify as HSA eligible. The law also allows people enrolled only in Medicare Part A to keep contributing to HSAs, something previously prohibited. Supporters see these as modern consumer-friendly reforms that expand choice, make innovative care models more accessible, and encourage people to save for healthcare expenses. Detractors note that HSAs primarily benefit higher income households who can afford to contribute, potentially widening disparities in access to care, and warn that these tax advantage accounts do little for low income Americans struggling to pay for immediate medical needs. In the end, the One Big Beautiful Bill represents a profound shift in US healthcare policy. It tightens eligibility, imposes new requirements, and reduces certain funding streams, while also introducing targeted investments and expanded consumer saving tools. Whether these changes will ultimately strengthen the healthcare system or leave millions more uninsured depends largely on one's priorities. Fiscal restraint and personal responsibility on the one side, or broad access and a safety net protection on the other. What's clear is this legislation will shape access to care and the stability of hospitals and the affordability of medicine for years to come, making it one of the most consequential healthcare laws in the modern era. Thanks for watching.